acetabulum and a fake femur head. Wow, I cannot speak right now. Guess who's back? Hi guys, doing Amar here from EverStrong Therapy, physical therapy and fitness designed to keep you moving at your best. Firstly, many apologies for the long delay. We have been really working hard on the back end of this company in order to provide as much value as we can, but we're back answering your questions from the internet regarding physical therapy. And today's question is, can physical therapy keep me from getting a hip replacement? Now, I think this is a great question, but I think there's a few sides to it. The first big component that we have to talk about is why you're getting a hip replacement. If the injury is catastrophic and you've shattered your acetabulum or your femur and you need a hip replacement in order to protect your joint and keep it moving, then I don't think physical therapy can do a lot to prevent you from getting that hip replacement. Obviously, catastrophic injuries happen and people do some serious damage to their joints, in which case, go for the hip replacement and we were happy to see you and get you back to full movement when you're done. Now, if the reason you need a hip replacement is due to arthritis or due to something that's a little more manageable, then I definitely think that there are some physical therapy techniques that we can utilize in order to either keep you from getting your hip replacement for a longer period of time or prevent you from getting your hip replacement altogether. If we can get you pain-free and moving better without needing a hip replacement, then that's even better. I tend to think that the best joints you have are the ones that you're born with. So if you can utilize those for longer, then that's better. There are definitely certain techniques that we have in physical therapy that allow us to strengthen the hip musculature and open up the joint space within your hip to allow more fluid in there, to allow you to utilize your own hips before you need a hip replacement, or give you the strategies in order to protect your hip in order to prevent you from needing a hip replacement in your future. It's a complicated question because it is a specific joint. But I think the big components to know is, why do you need the hip replacement? If it is something catastrophic, then I think that a hip replacement surgery where you actually get the joint replaced might be recommended. But if it is something that is not catastrophic, it might be worth trying physical therapy out first and managing your pain and mobility conservatively before you have to go towards an invasive route. Again, that's the answer to the question. I hope you enjoyed the video. Please like and subscribe, and we'll see you next time. Stay ever strong.